Now please comment whether I am audible. Uh, Background disturbance is there. Okay. Just give me 1 minute. I will come back. Okay. I will restart the system and so that it will work fine. Okay. So now please please tell me whether I am audible and visible. Is my voice working fine now? Is my voice okay? I hope now this background noise has been reduced. Okay. So these are the topics which will be covered in this particular session. So this was this was the question which I have asked post December 10th. So in this question I have shown a small coin which is usually made out of copper, and it was used during the British era in the India. It was called as Anna. Okay, so I have asked this question in my group Crack Derma with DrMSD. It's a Telegram group, so you can see what all answers students came up with. So that's so with that I planned that okay, this can be made into a small session where we can discuss all these diseases. So I have made this particular small topic. So this December 12th, it was the birthday of Rajnikant. So he in this movie, maybe you have seen, if you have seen this movie, it is Shivaji, and in that he plays this protagonist role in which he uses a coin to always uh, irritate the villain. Okay, so just a few lines. Before, Rajnikant worked as a coolie carpenter and he was a bus conductor. But with lots and lots of hard work and a little pinch of luck, now he's became a popular, respected, and highest earning actor. So always you should keep on carrying your good work, hard work, and consistently and persistently, so that results are going to come. So now please try to answer this particular question in this poll. So, welcome Akhilesh, Mahinder, Meghna, Swati. So, okay. So, Dr. Akhilesh says B. So, I want all of you friends to answer this these questions. So, don't feel bad or don't feel shy to answer. So, whatever you feel, you just type in. Even if you have not read this, also you just attempt the question, because attempting the questions is very very important. Yes, awesome friends. So almost everyone has answered it. So those who have answered it correct, it is copper poisoning in which talism is seen. But what is talism? It is increased secretions. That is, copious secretions of saliva can be seen in a person who has this copper poisoning. So can anyone tell me what is the condition which this copper poisoning mimics? Which medical condition? Okay, I will tell the answer. Okay, so copper poisoning will lead to hepatolenticular degeneration. Hepatolenticular degeneration. That is, features of Wilson's disease can be seen here. Okay, and there is one more very important feature which is seen in the gums. I will show you in that image. Okay, whenever if at all a question in the exam, they mention some discoloration of the gums. So always you should remember whether it is bluish discoloration or whether it is greenish discoloration, which is seen at the junction of the gums. So here in the gums, they can either mention the color of the deposition or they can even give you the picture also. Okay, if it is blue color, what is the poisoning which you should think of, and if it is green color, what is the poisoning which you should think of? Can anyone tell me the answer? Okay, danger alert, the answer is copper poisoning. Okay, it is not lead poisoning. Okay, the question which I have asked, blue color, yes, Dr. Milton Chakravarti are absolutely correct. Lead poisoning will show bluish discoloration over the gums, and it is in fact given a name called Burtonian lines. Okay, this is a very important question. It was asked previously also. And if it is green, obviously the topic of our today's discussion, copper poisoning is going to cause greenish discoloration over the gums because of deposition of copper sulfide. Okay, so now we will see few points about the zinc poisoning. So in the options, one of the option was zinc poisoning. So what are the features of zinc? So whenever there is zinc poisoning, there is a development of fever, that is pyrexia will be developed, and usually zinc, it is seen whenever there are metal fumes, and so it is called as metal fume fever, or it is also called as smelter's fever. And one more thing which you should remember, since there is a fever component which is the most important in zinc poisoning, this fever, it is going to mimic malarial chills. Okay, these are the 2 points which you should remember, metal fume fever and malarial chills. And if you observe the zinc, if you just put one more line here, if you just ulta the zinc, if you just ulta and put one line here, it becomes M. So you should remember that it is also called as metal fume fever, it is also called as metal fume fever, and it has malarial chills in its manifestations. Okay, these are very important points. And now I want all of you to answer, in which poisoning can we see golden hairs? Okay, one is obviously cadmium poisoning. So can anyone name in which other condition can we see golden colored hairs? Tarun Bhatia, yes, you are right, it is cadmium. So what, in which other poisoning can we expect golden hairs, golden colored hairs? So very good, Dinesh, Bhavya, Ganeshamurthy, Achilles, Saloni, Milton Chakravarti, Swati. So just answer in which other condition. So these are important from your forensic point of view also. Okay, please remember it is arsenic poisoning apart from cadmium poisoning in which we can see golden hairs. Okay. Okay. Medmia MBBS is telling protein energy malnutrition. So in protein energy malnutrition, there is one important sign associated. So it is flag sign. So can anyone tell me in which disease can we see flag sign? Is it Kwashiorkor or marasmus? So as the question was asked, Medamia MBBS, flaxen. Yes, Ganesh Murthy, flaxen. Yes, very good. Artika Mahendran in Kwashiorkor. In kwashiorkor, we'll get this is a protein energy malnutrition along with marasmus. In this, we'll get to see flaxen. So in this flaxen, what will happen during the periods of normal hair growth? So pigmentation will be there, so the hair will be black in color. Whereas during the times of malnutrition, there is going to be less amount of this hair pigment produced, that is melanin. So there will be again whitish discoloration because of the absence of melanin, and there will be again normal pigmentation during normal nutrition. This is called as flaxen. So very good, in kwashiorkor we will see flaxen. Okay, now can anyone tell me what are the features of arsenic poisoning? So with the help of the name of this itself, you can remember the manifestations of arsenic poisoning. So quickly, can anyone tell me? So A stands for this feature which you are able to see over the nails, and R stands for this feature which is seen over the palms. So can anyone tell me now? Can anyone help me to fill up this? Very good. Meghna says Mees lines. Yes, it is Aldrich Mees lines. Aldrich Mees lines, which is leukonychia. That is whitish discoloration which is seen over the nail plate. Okay, and R stands for, yes, very good Saloni and Ganeshamurthy, raindrop pigmentation which is seen over the palms here. That is both hyperpigmentation and hypopigmentation will be present at the same time. And what does S stand for? Can anyone tell me? Okay, this is a good mnemonic with help of which you can remember all the features. So can anyone help me with any other things? Okay, I will just tell you. E stands for excessive pigmentation. Excessive pigmentation will be there in arsenic poisoning. N stands for neuritis. Okay, there is going to be neuritis. It can be polyneuritis, and also optic neuritis has also been observed. And what does I stand for? And what does S stand for, and what does C stand for? C is very important. C is not colic, Dr. Aarti. C stands for rice water like stools which are seen in cholera. Okay, it mimics cholera. So C stands for cholera, and I stands for iron oxide and British anti-leviside, which are used in the treatment of arsenic poisoning. Okay, and S stands for subendocardial hemorrhages. Okay, that is the arsenic poisoning and small mnemonic with help of which you can remember all the clinical features of arsenic poisoning. Okay, this was the question which I have asked in my Telegram group. So please type in your answer. What do you feel is true about lead poisoning except? So you should identify which one is the false statement. Yes, very good, Nallamala Swati, hemorrhage. Yes. Subendocardial hemorrhage, right? Very good, great. So this was in fact it was in the news recently because of the Eluru incident. So that is the reason why I have put it as a question. Okay. So Meghna says it is status epilepticus, and Akhilesh says it is F. So if you have not watched the news, I think you are unaware of this news where in Eluru there was some sort of it was not confirmed, but the features of lead poisoning were present in the patients who came to the hospital with seizures. They were absent seizures, they were tonic-clonic seizures. So they were also status epilepticus seen in the children also. Yes, very good. Those who are telling F is the answer, all are correct. Okay, so please remember lead poisoning can manifest as status epilepticus, and please remember this type of presentation is more common in children. Okay, if there is a lead poisoning, chronic lead poisoning to be precise, children are the ones in whom status epilepticus can be a presenting one. And Burtonian lines, of course, this I have already explained you. It is seen in the gums. Measurement of the copper porphyrin in the urine is useful screen test. This is also a correct statement. Basophilic stippling of RBCs are typical but not specific for lead poisoning. This statement is also right. Why it is not specific? Because this basophilic stippling can be seen in thalassemia and B12 deficiency also. So it is not very much specific for lead poisoning only. Facial pallor is very important. It is most consistent and the earliest sign of the chronic lead poisoning. Okay, so all the statements are correct. And in fact, there is a very beautiful mnemonic also for this lead poisoning also. It is A, B, C, D, E, and F. Okay, where A stands for anemia, B stands for basophilic stippling of the red blood cells, and you can even remember B for Burtonian's lines also. So Burtonian's line, basophilic stippling. See here, someone has answered it as colic previously. So please remember it. Yeah, Artika Mahendra. So colic is here. Okay, it is there here in lead poisoning. And D stands for drops. It can be wrist drop, it can be foot drop, all the drops. And E stands for encephalopathy. Encephalopathy, and it is due to this encephalopathy which we can have the status epilepticus like feature. And F stands for facial pallor. Okay, these A, B, C, D, E, F, with the help of this mnemonic you can remember all the features of the lead poisoning. Okay, so now please try to answer this particular question. Yes, Dr. Darshana has the facial pallor, right? So coin shaped eczema, this looks like a seemingly simple and one liner question. This type of question was recently asked in the INICET also. So great guys, very good. So all of you are with the right answer bang on. So please remember, now we are coming to the coin. So coin shaped means circular shape, and these type of lesions, they are also called as discoid. That is disc like. Wherever oid is there, you should remember that like. Oid means like. So like for example, we have target lesion and targetoid lesions. Okay, pemphigus is there, pemphigoid is there. So some disease, when some condition or disease or any shape which is something similar to the previous one, it is given just this suffix of oid, and this is called as discoid. So we will see the how the this lesion will appear. So this is the typical discoid lesion of discoid eczema, in which you are able to see most probably you will be confused with annularity and discoid. So I will show you how the annular lesion will look like. But here you can see there is erythema present over the entire lesion, and you are able to see some oozing also is present. Okay, circular lesion, oval lesion is there, circular or oval lesion with oozing, and the patient is going to complain of itching. And since this lesion is present in a round way, that is, it is mimicking like a coin, that is the reason why it is called as discoid eczema. And it is the eczema, why? Because there is characteristic oozing which occurs precisely in acute eczema. In subacute and chronic forms of eczema, there will not be much of oozing, only there will be just erythema and scaling which will be remaining. Okay, now please try to answer this particular question in the poll, friends. So identify the lesion based on the morphology. So I want all of you, your confusions to go away by looking at this lesion. So this was the INICET question which was asked in this November 2020. Yes, guys, it is annular. So whenever you see a circular lesion, you should always think about target lesion, annular lesion, and discoid lesion. So how can you differentiate? In this particular discoid lesion, there is entire skin involvement in the particular lesion. There will not be any skin sparing, And whereas in an annular lesion, if you have to call a lesion annular, there should be central clearing, a clear central clearing. That is, this part of the skin will not have any erythema, will not have any oozing, redness. It will be completely normal, just like the surrounding skin which is seen outside the lesion. This is, if you treat this as the entire one as one lesion, so the outside skin, if you call it A, so inside this lesion, if you call B, A and B will be almost same. At the periphery, at the this periphery, that is the margin of this lesion, what you can observe is there will be erythema, which is going to tell you that the disease is active here. And there will be scaling also, there will be scaling. So these are the features which will tell you that this is an annular lesion. Okay, so these are also annular lesions. This is one annular lesion. So if 2 or 3 annular lesions which are present adjacent, they coalesce, then they are going to form these kind of shapes. Okay, like these shapes will be formed when they are fusing to each other, and these are called as polycyclic lesions. And please remember, polycyclic lesions is a classical descriptive term which is usually reserved for herpes lesions. It could be herpes labialis, herpes genitalis, and one more. In the lupus, it is subacute cutaneous lupus erythematosus. So if at all there is a mention that a lesion is polycyclic, you should think about these two conditions as important differentials. Okay. Yes, now please try to answer this particular question. This could be a future MCQ. Solitary, please read this question very carefully. There is a solitary erythematous oval lesion with central clearing giving target appearance. So in the question itself, word target lesion is mentioned. Target lesion is also called as iris lesion. Okay, but what is the most important part is it is written solitary. Okay, so I can understand most of you are answering it as erythema multiforme, but erythema multiforme is not the answer here. So please remember, solitary target lesion, whenever it is given in a question, the answer is erythema migrans. The full name is erythema chronicum migrans. Okay, this point I want all of you to know. That is the reason why it is a future INSET question which can be asked, and you can expect it. So this is the typical target lesion. Typical target lesion, and where you are able to see the 3 zones are present. Central erythematous zone, if you call it as 1, 2 and 3. So 1 is going to be red. There can be papule, vesicle, bulla, anything can be there. So 2 will be pale because of the edema, and zone 3 will be again red. Okay, these 3 zones will be there in a single lesion. And please remember, in erythema multiforme there will be multiple target lesions, which are concentrated over the distal extremities. So multiple target lesions which are present over the distal extremities. It is characteristic of erythema multiforme. EMF stands for erythema multiforme. Whereas whenever there is a ixodes tick bite, so these ticks, these parasites are all important. Whenever there is this ixodes tick bite, it is going to transfer Borrelia burgdorferi into the host. When it is going to manifest as a single lesion, only single lesion, where there will be central erythema surrounded by a zone of pallor and surrounded by a zone of red erythema. So this is having appearance of target, so it is called as target lesion. But the characteristic of this lesion is it is going to be single target lesion, wherever this tick has bitten, only those areas there will be, yes, very good, Lyme fever. It is also called as Lyme's disease. Only that area will show a single target lesion, that's all. Okay, it is called as Lyme's disease. The skin manifestation, it is given a name, it is called as erythema chronicum migrans. Okay, erythema chronicum migrans. So the very important point you should remember, this could be a future MCQ. So now please try to answer this. This question could have multiple answers. So can anyone guess or tell me what is the answer and what is the diagnosis which you are thinking about? Very good, Vasavi, you are correct. Lyme's disease, correct. So please give me the answer for this question. Okay, there can be more than one answer which can be correct in this question. Okay, this is a multiple answer question. I have mentioned it here. It's a multiple answer question. Yes, very good, Dinesh. It is in fact DLE, discoid lupus erythematosus. Very good. And those who have answered it as A and B, very good. You are right. Dr. Akhilesh, it is not psoriasis. Okay. I will show you what is the important sign which is seen in psoriasis. And this here, this case is a discoid lupus erythematosus. So I will describe how the lesion will appear. And please remember, discoid lupus erythematosus, both A and B, that is carpet taxane and Schuster sign, both are positive. Okay, both are positive. And again here you can see that the lesion is having the word discoid. So that is the reason why I have put up this particular question in this group of questions. Okay, discoid lupus erythematosus. So briefly, if you have to know about these lupus erythematosus, these are basically a spectrum of disorders ranging from only the skin involvement. Only the skin involvement, if it is there, we are going to put it under discoid lupus erythematosus. If there is cutaneous and some systemic manifestations, we are going to call it as SCLE, that is subacute cutaneous lupus erythematosus. And if there is mainly systemic involvement, then it is in the spectrum of systemic lupus erythematosus. Both all of these are basically autoimmune connective tissue diseases where antibodies are produced against the nuclear material. Okay, that is the reason why we have anti-nuclear antibodies. And coming to the discoid lupus erythematosus, here we will see again three zones. Okay, if at all the disease is very active, then we will see three zones. Okay, the centralmost zone, it is going to be either red or white, that is depigmented skin will be there along with scarring. And in the central zone, what we can observe is there will be three important features which can be seen. One among them is scaling, and the other one is going to be follicular plugging. Okay, so these two are the most important ones, and the third one will be, there will be of course erythema, inflammatory changes because of the active disease. And at the periphery, you should remember the most important feature, hyperpigmented rim will be there. Okay, so if you in the question, if you happen to see a central lesion is showing whiteness, that is depigmentation, and periphery is showing hyperpigmentation, that is blackish discoloration, then you can straight away answer it as a discoid lupus erythematosus case. Okay, and because of this follicular plugging and scaling, because of these two features, we have one sign, that is carpet taxane. I will show you about that also. And if this DLE lesion, if it is present over the concha, if this lesion is present over the concha, that is central depigmentation is there here, and it is surrounded by hyperpigmented rim, then we are going to call it as Schuster sign. Schuster sign is seen in discoid lupus erythematosus. This was a previous question, so you should know about this. And what is this carpet taxane? So I have told you that scaling and follicular plugging are seen in this DLE lesions. So if because of what is this follicular plugging, because of this DLA inflammatory process, there is going to be lymphocytic variant of scarring alopecia which will be seen, that is there will be loss of hair follicles. So if you take, this is the epidermis, and if you take, these are the hair follicles. So the usual hair follicles, they will be they will not be empty, they will have the hair follicles, whereas in this DLE, the scale is going to occupy this hair follicles and it will form follicular plugging. it will form the follicular plugin. Okay, because of this, if you try to remove this scale, then this scale will come out and there will be small projections. These were the scale, part of the scale which is present inside the follicle, and these are going to appear as if some nails which are used to secure the carpets onto the floor. Okay, so this has been compared with the carpet, the scale, sorry for the handwriting, okay, carpet, and these nails, they are called as tags. Okay, they are these scales, these follicular plugging, wherever is present because of these scales. So this is the reason why we call it as a carpet tag sign, which is positive in the case of carpet tag sign, or it is also called as tin tag sign. And since if you have a cat as your pet by mistake, or if you are interested, so if you observe the tongue of the cat, you can see that there are tiny projections over the cat's tongue. So because the scale is also having similar projections, so it has been compared with that, and it is also called as cat tongue sign. So all of these are very important to be remembered. All these signs could be potential future MCQs also. So not only skin will, we have already seen that there will be lymphocytic variant of cicatricial alopecia. So here you are able to see there is loss of hair also, which can be seen. So now can anyone tell me what is this particular sign which I am demonstrating here? So very good, Abhirami, Darshana. So can anyone tell me what is this sign? Yes, very good, Auspit sign, where psoriatic lesions are described as papillosquamous. Okay, this squamous word is used. Why? Because there will be scaling in these in the lesions of psoriasis. Okay, so in psoriasis, if we try to remove the scale with the help of a glass slide, then we can see pinpoint bleeding. Pinpoint bleeding can be noted. So before this, there are many steps. Okay, the scale will be removed gradually. It is called candle wax sign, and scraping of this lesion with a slide is called as grattage test. So after all this, after bulkless membrane is removed, there will be bulkless membrane, and it will be removed, and ultimately there will be appearance of pinpoint bleeding, and if it is seen, it is called as Auspit sign. So Auspit sign is positive in psoriasis vulgaris. But please remember, Auspit sign need not be present in all types of psoriasis. There are some types of psoriasis, like for example pustular psoriasis, erythrodermic variant of psoriasis, and guttate psoriasis. So PEG is the mnemonic. In all these variants of psoriasis, Auspit sign will not be seen, and Auspit sign will be negative. Okay, so you should remember that. And one more thing which you should remember is Auspit sign is not only just specific for psoriasis. It can even be seen in actinic keratosis, which is a condition associated with sun exposure, solar exposure, and it can also be seen in the case of Darier's disease. So in the literature it is there, and since all these diseases, Darier's disease and actinic keratosis, were also previously asked, so you should remember in these disorders Auspit sign can be positive. And can anyone tell me what is this particular sign which we are discussing, which I am showing here? So there is a child with multiple hyperpigmented lesions over the back, and there is one lesion where you are able to see erythema. So what is this particular sign which you are eliciting in this kid, and what is this condition? Can anyone tell me? It was in the options actually while I was discussing. Very good. Yes, it is. It is in fact a case of mastocytosis, or also called as urticaria pigmentosa. Urticaria pigmentosa, where if you use a blunt end of your pen and if you stroke this hyperpigmented lesions, All these hyperpigmented macules and patches, they are going to have the mast cells proliferating. So if you stroke the skin here, what will happen? There will be release of mast cell mediator, that is histamine. So because of the histamine release, just the manifestation which is observed in the case of urticaria, in dermographism, the same manifestation will appear. That is, there will be a wheal formation. Okay, this is given a name called Derriere sign. What is the small difference in Derriere sign and dermographism? Is in dermographism we are going to stroke the normal skin, whereas in Derriere's in this urticaria pigmentosa, that is Derriere sign, we are going to strike the skin which is affected. Okay, and one more point which I want all of you to remember is Derriere sign is not seen in Derriere disease. Okay, so this is a very important one-liner which many students usually make a mistake in. Okay, now please try to answer this question, friends. Okay, Achilles, B. Okay, great guys. The answer is B, of course. So whenever you see a case which is telling Himachal Pradesh, that is what they want to mention is that it is a hilly area where usually soil there will be fungal spores which are easily present. And the question also mentioned there is a thorn prick whenever there is any trauma because of vegetable matter. Always you should think that there could be fungal spores present over that vegetative matter, and that can be introduced deep inside the skin, causing deep fungal infections. And the question also mentioned there is a verrucous lesion over the knee which developed, and this is the verrucous lesion where there is a large block of this verrucous lesion, that is a rough surface lesion, which is almost appearing like some cauliflower. And in the question I have also given one more clue: copper penny bodies. Okay, copper penny bodies and this kind of verrucous lesion with the history of thorn prick, always you should think of chromoblastomycosis. So I will show you what will be the features of other diseases also in this particular question which I have given. Okay, so whenever you get to see these type of infection, thorn pricks, okay, this word whenever it is mentioned, you should always think of sporotrichosis, chromoblastomycosis, and other disease mycetoma. These are the three conditions which are the important deep fungal infections. Always you should think about these three conditions. Okay, lesions along lymphatic sporotrichosis. Yes, you are right. So this chromoblastomycosis is having another name. It is called as verrucous dermatitis. Why? Because there are lesions which are verrucous in nature, and it is caused because of dematicious fungi. There are many fungi depending upon the geographic area where we live. These are dematicious. Why? Because they are going to produce melanin, and they will have the color that there will be a color which can be seen, and that is the reason why they have this name chromo. Chromo means color. And few of the names: Fonsissa pedrosa, these were tested previously, Fonsissa compactum and Philophora verrucosum. Okay, these you should remember. And how can you differentiate chromoblastomycosis from verruca vulgaris, which is caused by human papillomavirus? Is simply chromoblastomycosis. There will be some history of thorn prick, or some vegetative matter trauma will be given, and in the verruca vulgaris, usually it will not be a single lesion. So clinically there will be multiple warty lesions will be there. That is one differentiating feature here, or usually it will be a single body lesion, and in the history it's not so much pertinent actually, but here there can be history of years together. That is, there will be a very chronic history, whereas here it will be mostly it will be acute, but this is not a very important differentiating feature. So what is the most important differentiating feature is multiple lesions will be there clinically, and the other one is there can be development of some discharge. So discharge can be present in this chromoblastomycosis, whereas these lesions will be always closed if the patient meddles or if there is any treatment taken, otherwise these lesions will be intact. Okay, that is how you can differentiate. And if you do a histopathological examination, you can observe these brown bodies in a case of chromoblastomycosis. Okay, these are called as medlar bodies, copper penny bodies, muriform bodies. So these are also called as sclerotic. So there are so many names. These are basically the fungal elements. So these round shaped, coin shaped structures are brown in color, and they are given so many names when they are found out in the histopathological examination. Okay, yes, this is one more picture where you are able to see this round medlar bodies. Okay, yes, this is another picture. So can anyone tell me what is this condition from the image? Just from the image, can you tell me what is this deep fungal infection? So it is appearing very gross. Yes. Meghna, no, it is not sporotrichosis, okay? And yes, all of you are right. Yes, it is mycetoma. Okay, it is a case of mycetoma. But to differentiate it as eumystoma or actinomystoma, we need to do further investigations. Okay, this was explained in a detailed fashion in INICET recall session, so you can check out that session. Okay, it is available in under my this thing in the Telegram group. The link is there, and if you follow me on Unacademy, in my Unacademy list of special classes, it is there, INICET recall session. You can download the PDF and read that class also. And can anyone tell me what is this deep fungal infection, where you are able to see linear nodules arranged in along the lymphatics? Yes, very good. Sporotrichosis. Sporotrichosis caused by Sporothrix schenki. Caused by Sporothrix schenki. Very good. You are right. And can anyone tell me why did I put up this image of a satellite? Yes, very good, Dr. Ganesh Murthy Bhaskar. They have put this picture wantedly. It is because satellite lesions are going to be seen. What are satellite lesions? So whenever there is a thorn prick or any trauma, the organism is going to multiply at this site and it will spread through the lymphatics. That is the reason why there is a linear arrangement of the lesions. And whenever the lesion will grow further, then there will be the immunity will not be able to contain the infection, so the lesions jump and there will be surrounding small lesions also appearing, new lesions. It is because of this these lesions are given a name called satellite lesions. Why? Because they are surrounding the main lesion. Okay, and can anyone tell me what is this appearance called as in histopathological examination? Okay, so this appearance, so can anyone tell me which is seen in sporotrichosis? So Bhuvana Raju, mainly the treatment will be with itraconazole, okay? And also it depends upon which type of sporotrichosis we are dealing with. If it is mainly lymphoproliferative, then the treatment will be with saturated solution of potassium iodide. And if it is only ulcerative lesion over the skin, then it will be itraconazole. Otherwise, if there is systemic manifestation in the form of pulmonary involvement, then amphotericin B is the preferred one. Yes, very good. Sky asteroid body, right? Very good. Asteroid body will be seen in this condition, sporotrichosis, but it is not so specific. Even in the case of sarcoidosis also this can be seen. So why is this given this name asteroid body? Because you can see here central east is there with surrounding eosinophilic material, which is something having a similarity with the star. So you can briefly remember that sporotrichosis is actually called as just a rose gardener's disease. It is also called as rose gardener's disease, NERS. Yes, rose gardener's disease, but the manifestations of this rose gardener's disease are going above the sky, and you can see satellite lesions are there and also asteroids. So we have gone to the stars also. Okay, so these are all the manifestations of this particular condition. So yes, you are right, cigar shaped. Yes. Okay, we shall continue the remaining questions in the tomorrow's discussion, friends. So okay. Okay, we shall continue it in the tomorrow session. Okay, so before ending the session, so I want to thank all of you for the great participation, and before winding up, so we will discuss the remaining questions along with few added questions in the tomorrow session. So please remember while studying, so I have seen many students, they do not know about this or they have not heard about this. It is called as Ebbinghaus forgetting curve. So always remember, whenever you read something today, okay, so after 7 days, if you, for example, on the day one you read 100 one liners, so by 1 week you will forget 80 and you will only remember 20. So what you should do to handle this forgetting thing, I will tell you the answer for that. What you should do, I will show you. But before that, small point about Unacademy. You have just now attended the class from the India's #1 edtech group, that is Unacademy, which is the India's largest online teaching platform. So okay, if you have not yet downloaded this app, you can download this and you can watch the videos. Not only the videos, but you can also attend these sessions. That is 20 MCQs are being discussed. That means they are being tested every day on Unacademy app. If you have the app, you can attempt these 20 questions. If your target is 2021, then at 8 o'clock these questions can be attempted, and if your target is 2022, the session will be at 9 o'clock. Okay, so even if you are planning to take 2022, you can also attempt the 8 o'clock session too. And if you did like this Unacademy concept, you can subscribe to the Unacademy and become a subscriber. Okay, what will be the benefit? There will be daily live classes. So instead of the recorded sessions of the classes, which many students may feel boring, so these live classes will be very interactive, where all the students will be very actively participating, and the courses are very structured here. The courses are structured and well told beforehand, and there will be live tests and quizzes. So not unlike the recorded sessions, these sessions are going to be very very interactive, and you will get a feel as if you are sitting inside a class, but without any difficulty to just step outside of your home. You can happily attend these wonderful classes. So there is unlimited access, just like if you take pass to any uh, and if you go to any zoo or anywhere, so you get access to everywhere. You can watch any animal, you can go anywhere. So just like that, this particular plus subscription gives access to all the subjects, and in each subject there are 3 to 4 faculties which are explaining the topics. So you can according to your comfort and according to your frequency, the frequencies of students will be different students like to be slow, and few students like to be fast. So you can select your faculty of your choice, and you can join the classes, and you can attend them. And this is the details of this plus subscription. So you can use my referral code DrMSD, and also after you download this app, you can use DrMSD to unlock all your special classes which are free. The special classes are all free. That is the wonderful feature, where you can attend all the classes and review one. If you do that is immediately after the class, so you can see that the forgetting percentage is reducing. So if you do the review 2 after 1 day, then the chances of you forgetting will reduce, because what will happen, your ultra short term memory will transfer into short term memory, and it will transfer into long term memory. So by revision 3 and revision 4, that is after 1 week and after 1 month, so you should plan your revisions are the key. Revisions are the key to beat this Ebbinghaus forgetting curve. Okay, so our memory is always going to reduce. So with help of revisions, you are going to beat this particular forgetting curve. Okay, and you are going to remember, and you can see here, after so much duration also, almost 80% can be remembered. This is possible only because of repeated revisions. Okay, the plan should not be like, today I am going to read the skin, and after 3 months again I am going to pick up the books and I will again revise. No, this is absolutely wrong. This will not work. Always revision should start from day 1. You should start revising whatever you have read today, yesterday, day before yesterday, a week back, a month back. So every day revision should carry on. Okay, this is the evening batch for the target next 2022. Okay, these are all the faculty which are going to teach in this particular session. So this has already been started from 21st December. So you can join in this particular batch. So the classes will be in these timings, 3 p.m. to 5 p.m. So if you like to join the class which have to course which I have told you previously, in that the skin will be covered over 15 days in 2 hours time, whereas in this particular batch, okay, all the classes are fixed, and they are going to be 6 hours per day, and dermatology is going to be 6 days. So it will be 36 hours course. It will be slightly more extensive kind of course, you can say. Okay, if you want to download this PDF, you can join my group. I'm going to post this particular PDF in this Telegram group. Okay, and I suggest and I advise and urge you all to download this PDF and just have a quick review of this particular topics whichever I have till now covered. Okay, so that is it in this session, guys. So I thank you so much. If you are not yet following me on Unacademy, you can follow me to get all the latest updates of my Unacademy lecture videos. Okay, I thank you so much for all your patient listening. And as the corona is again maybe coming back with full force, we don't know. So please do continue using SMS, social distancing, mask and sanitization, and as usual, as always, Dr. Maddineni Srinivas signing off. Happy learning. Bye bye.